We're going to give folks just another minute or two and then we'll get started.
Good morning, everyone. All right, well, we're going to go, it's 9:02, so let's go ahead and get started. First up, I want to again say good morning to everyone. I'm going to go ahead and share my screen here. Hopefully everyone can see my screen. And I want to welcome you all to Wyandotte County's Public Health Department's first Business Town Hall meeting. And my name is Nicole Garner, and I am with the Health Department. And before we get started, I wanted to go ahead and thank all of our partners for all of their support in making this event possible. I wanted just to quickly go over the agenda for this morning. First, we're going to talk about and discuss how to respond to COVID in your business. We're also going to discuss some of the frequently asked questions, and these are the questions that we're hearing quite frequently here at the Health Department. We're going to also talk about some testimonials and get two testimonials from local businesses here in Wyandotte County. We're going to also discuss resources for your employers and employees. And then lastly, we're going to discuss or have a Q&A session. So we want to hear from you. So please submit questions that you have in the chat box. Before we begin, I'd like to again introduce our panelists. Again, my name is Nicole Garner. I am the COVID Program Manager here at the Health Department. I also want to introduce Janelle Friesen. She is our Public Health Officer at the Public Health Department. Also, Haley Shoemaker. She's our epidemiologist here. Dr. Erin Corvo. She's our Deputy Public Health Director here. Kate Webb. She's a controller at the Core Slab Structures business here in Wyandotte County. And then lastly, David Staker, who is the CEO and president at Plastic Packaging Technologies. All right, well, I'm going to turn it over to Haley Shoemaker, who's going to discuss what to do if you have an employee that tests positive in your business.
Well, thank you so much, Nicole, and thanks so much to everybody for coming out this morning. We're going to go through a step-by-step updated guideline of what to do if an employee tests positive in your business. So let's get started. So we came up with this 4-step cycle. The first thing you want to do is respond. The second thing is make sure your employees are isolating and quarantining appropriately. Third, get everybody back to work. That's the most important. And then fourth is keep monitoring the situation and continue to adjust to make sure that you can reduce any further cases in your business. Go ahead. Okay, so step 1 is respond. So that's going to be 4 steps, and we'll go through all 4 steps. First step in there is to make sure the sick employee is isolating at home, making sure that their work area is clean, getting some information about the employee's illness, contacting us at the health department, and then doing what we call contact tracing, and we'll go over that later as well. Okay, so if your employee is ill or becomes ill at work, especially with symptoms, our COVID symptoms like shortness of breath, fever, chest pain, difficulty breathing, vomiting, nausea, diarrhea, any of those symptoms at work, they should definitely be sent home. If they call in and say that they have any of those symptoms, they should not come to work. I did want to make a point here. We keep using the word isolation with regards to a sick employee, and you should realize that isolation and quarantine are different. We use isolation to talk about a person who has coronavirus, who has the virus and who has tested positive, or who has symptoms of the virus and will test positive. And we use quarantine to talk about people who've been exposed. So you'll see those two words coming up here, and they don't mean exactly the same thing. So if a person is ill, you send them home to isolate. We'll go over that timeline later. If possible, you should evacuate that employee's work area. Now, does that mean if you have a whole warehouse that you have to evacuate the whole warehouse? Well, no, just the area where the employee was working. Like if it was a smaller room, you would send everybody home out of that area. A classroom size area, you'd send everybody out. If the employee had their own office alone, you don't have to send anybody home. If possible, leave the area where the employee was working empty for 24 hours if you can, and then go through and clean it. You can use a bleach solution or a number of other industrial cleaning solutions that you're probably already using. Most of those are able to destroy coronavirus. And if you're not sure, you can find a list on the CDC website of chemicals that will destroy COVID. So let's go ahead. Okay, so then you need to gather some information about what happened. So the first thing that you're going to need to know is, what day did the person start feeling sick? If they did get tested, sometimes you find out that you have a positive employee because they call you and say, hey, I tested positive for coronavirus. And so if that happened, then you need to know what day that they got tested. You need to know what was the last day that they came to work or the last day that they were around other employees. And then start thinking about their close contacts. So that would be maybe, who did they work next to? Who did they eat with? Who did they carpool with? Did they attend any employee gatherings, official or unofficial, that involved other employees from your company? And this might take a little bit of digging, but you can certainly ask the employee in question about this as you're gathering this information. Go ahead. Okay, so then the next thing is you're going to report, especially if this is your first positive case, please give us a call, report this information to the health department. So I'm the COVID business liaison, unofficially. This is my email address. My name is Haley Shoemaker. We can send you this email address again at the end. And then this is my phone number. So if you do have a positive case, we ask that you report it to me. On this phone call, you can also ask me any questions that you might have about any weird or odd situations that aren't covered in this PowerPoint, of which there are many. And we'll give you some additional guidance on what you can do. Go ahead. Okay, so we're going to talk next about contact tracing. So first, I wanted to outline the importance of contact tracing. First of all, coronavirus can actually be contagious before a person starts feeling sick. So if I start feeling sick on Wednesday, I could actually have been spreading the virus unknowingly to other people on Monday and Tuesday. And so that's why it's really important to try and figure out who the close contacts of the case were and get them sent home as quickly as possible so that they don't have the chance to spread the virus to other people before they start feeling sick. We also want to prevent spread of the virus to vulnerable people. So that's anybody over the age of 65, anybody with any background health conditions, especially diabetes, heart disease, lung disease, or anybody who is immunocompromised for any reason. These are people who are especially vulnerable to severe coronavirus, the type that has you end up in the hospital. And that is the main reason why we emphasize contact tracing, and we ask for your help in doing this in your business. Okay, so go ahead, Nicole. Thank you. All right, so what do you actually do for contact tracing? You're trying to evaluate who this person was within 6 feet of for 10 minutes total. You might see a different number on the CDC website, but we're going with 10 minutes. Less than 6 feet for 10 minutes total, that counts as close contact. So let me walk through a scenario. Suppose that John is symptomatic with coronavirus on Wednesday. So you're doing contact tracing on Monday and Tuesday. Suppose that John had a conversation for 5 minutes with Sally on Monday, and he had another 5-minute conversation with her on Tuesday. In that case, Sally would be considered a close contact because she was exposed for 10 minutes total on the days that John was contagious. John's also contagious for 10 days after he starts feeling sick. Normally, people don't work through the entirety of that 10 days. Normally, they would call in sick, or you would catch it early and you could send them home. But you would also do contact tracing on any day that they were at work, they felt sick, and up to 10 days after they started feeling sick. So like I said, you start 2 days before the symptom onset. You include any day they work when they were sick. Any close contacts, by that definition, should quarantine at home for 14 days from the date of contact. All right, go ahead. Okay, so here's the money slide. This is the difference between quarantine and isolation. So sick or positive employees are meant to isolate at home for 10 days after symptoms begin. If they can go for 72 hours at the end of that 10-day period, the last 72 hours of that period, they have no fever and they're not actively suppressing the fever with like Tylenol or ibuprofen, plus they have a major improvement in symptoms, then they're able to come back to work. So this rule is kind of the major improvement in symptoms is there because obviously if somebody's really, really tired, they're so tired they can't get up, they're still vomiting, but they don't have a fever, then you wouldn't want them to come back to work. But in the case that an employee has no other symptoms other than a loss of taste and smell, or maybe they just have a runny nose but no fever at the end of that 10-day period, it's okay for them to come back to work. They are no longer contagious to others. For contacts of positive cases, however, we want them to quarantine at home for 14 days from their last contact. So some people might ask, well, why is it if you're not sick, you have to stay at home longer than if you are sick? The reason is because we're looking at two different aspects of coronavirus here. The 14 days is what we call the incubation period. So that's the time from when you are exposed to the virus until you can become ill. And that can be up to 14 days. So if I'm exposed on Monday, I could get sick the following Friday from that exposure. 95% of people do have symptoms within 11.5 days of exposure, and the 14 days captures that last 5% of people. We ask that you get tested 7 to 9 days after you're exposed. So it's not like food poisoning where maybe you eat some bad chicken and then the next day you have a stomach ache and you throw up. That's not how coronavirus works. You are much more likely to get an accurate test if you will test positive 7 to 9 days after the exposure. If you go and get tested the next day after being exposed, you're going to get a negative test, but that doesn't tell you if you will develop the virus later or not. So we ask that you wait 7 to 9 days after exposure before getting tested. And then finally, even if you do test negative, this is very critical, you must stay home for the remainder of the 14 days. For the reason I said before, because coronavirus does have a 14-day incubation period, you could test negative on day 7 and then have symptoms on day 14. And if you were at work at that time, then you would expose other employees and bring the cycle back to 0 again. Okay, so 3, this is the part we all like, return to work. Good news, once your employees meet the isolation and quarantine guidelines, they can come back to work. They don't need to get another test. You can ask your employee to provide test results to you, but we can send those results to the employee directly. So you can ask them to show you the results if you would like to see them. And you can go on to the next slide. So then the next thing we're going to ask you to do is monitor. So stay on top of the situation to make sure that you don't have any more COVID cases. And so that means 3 things. 1, you're going to increase your COVID mitigation efforts. 2 is communicate with your employees. And then 3, keep looking over the situation and keep changing your policies as needed. Don't get stuck in stone. Okay, so here's a quick list of things you can do. I'm sure many of you guys are already doing these things. The first one is to require masks. Many companies make masks optional inside, but we ask that you require them. And that helps to reduce pressure on employees who do want to wear them and want others to wear them, and maybe others don't want to wear them. And it becomes, if you just require masks inside of your building, it makes things uniform and it helps make sure everybody's protecting themselves and the people around them. You can also refuse entry to customers or employees who don't want to wear a mask. If they need to come inside at your business, you're allowed to not let them enter. You can also provide paid COVID leave to your employees. A lot of companies are providing 80 hours of paid leave to their employees, and we understand that not all businesses can afford to do that. And we'll talk about some resources available for you later in the presentation. When employees are coming in, many of you guys are screening people for fever, and that's great. You should also screen them for other common symptoms of COVID, such as cough, shortness of breath, nausea, vomiting, muscle aches and pains, even extreme fatigue. And you can find a full list of symptoms on the CDC website. Also, keeping employees informed is keeping employees informed is really important because rumors travel really fast. And so you want your employees to hear it from you first. We are not asking you to divulge personal health information. Obviously, that's a HIPAA violation, and that would be not good. But it's important if somebody does test positive for COVID within the business to, at the very least, let your employees know that in the case someone tests positive, you will inform those who were exposed, and the people who were exposed will be sent home to quarantine. So you don't even necessarily have to tell them when there was a case, but just reassuring them that if they were exposed to coronavirus, they will be informed. That's the minimum that we would ask you to do. And if an employee reports that they have sick family members in their household, then you should ask them to stay home in quarantine, and you can call us and we can discuss that situation, because each of those might be a little bit different. Okay, go ahead. Okay, so here's some more mitigation efforts. Ask your employees to wear masks in a carpool. Close your break rooms. Reduce the number of tables in your break rooms, like remove every other table or have one chair per table, and reduce congregation points, things like coffee machines, soda machines, water machines. You can have kind of like a 6-foot bubble around the machine and state that, you know, only one employee can come into that 6-foot bubble at a time. You can close them down completely if you want. You can just have so few people in the break room at a time that it doesn't become an issue, but think about those places where employees will congregate and try to reduce congregation at those points. Go ahead. Okay, we're almost done. So finally, we encourage you to keep a log of cases and contacts. Write it down. Who got sick? When did they start having symptoms? When did they test positive? When is the start of their quarantine? When is the end? When is the start of their isolation? When is the end? Keeping that in a spreadsheet will be helpful. Please report any positive cases that you have to us at the health department. And if you have any tricky situations that you're not sure how to handle, report those to us too. That's our job, and we're here to help you. So if there's anything we can help with, please don't hesitate to reach out. Okay, and so now we're going to move on to our business testimonials. I'm very delighted to introduce our first speaker, who is Kate Webb from Course Lab Structures. Course Lab Structures produces pre-stressed concrete products for railroads, heavy highway components, box culverts, noise walls, and retaining walls. And so we're very happy to have Kate here, as she's done a great job managing COVID at Course Lab. And so we'd like to ask Kate to go ahead and tell us about your experience with COVID this year.
Okay. Yeah, thank you. That's been really helpful. I would say, you know, this whole thing started in March, of course, and we tried, you know, find out information just like everybody else. How do we keep our employees safe? How do we continue to stay open, because we were considered an essential business? And so we were lucky, you know, we had increased hand washing stations, and, you know, and the guidance has continued to change. So that was good to stay informed. I would say our first case was not until early May, and that was an employee who was in close contact with a family member. So we didn't have a positive case, but we did require him to quarantine, and we notified employees that they may have been in contact, which was kind of the guidance then. We've continued to have, you know, the same kind of thing. Family members test positive, and so the employee has to quarantine. Or we had one situation in early August where within a crew, somebody, and we're outside, I should say, we're outside, spread out, so we have different crews. And so we've tried to limit how many people work closely together. But we do have one crew where somebody did test positive, and so the rest of that crew had to quarantine. So we kind of had a situation where we had to have people fill in, and it didn't go quite as smoothly as it should have. But with the quarantine, as far as work, but with the quarantine, that was fine, and everybody was willing to do that. We do qualify for the 80 hours of emergency paid sick leave that's part of the FFCRA. So employees that are required to quarantine for whatever reason, their illness or close contact, are eligible for 80 hours of paid leave. I would say we're starting to run into some cases where maybe an employee has to have a second round of quarantine because maybe they were exposed to another family member, and so there's a little concern about continuing. We've had good compliance with self-reporting of symptoms or that their family members are ill, and so we haven't had an issue where we feel like people are coming to work sick and hiding it and worried about being paid. But as this continues, that's a concern. We haven't had it yet, that if they exhaust all their time, vacation time, the 80 hours of emergency paid sick leave, will people stop reporting so that they can continue to come to work? But we actually just recently, a couple weeks ago, had another case where some people had to be sent home, but they were more than willing to comply, said, no, we want to keep our families safe. And so we haven't had issues with that. As far as keeping employees informed, we've had some plant-wide meetings outside, where we can be outside and talk to people and just, as guidance changes, just say, what are we doing? We did start implementing required face masks. We had encouraged that before. And I know face masks don't eliminate the need for quarantine because, the health department has said we don't really maybe trust that employees are wearing them correctly, but whatever we can do to mitigate the spread, we're doing that anyway because, so we've had some pushback on that. Well, if I still have to go home, why do I have to wear this face mask? Because they're outside and it's hot. But we've gone to mandating that rather than just suggesting it. I was going to say, I think that's about it. Did I miss anything?
No,
Haley?
not at all. No, not at all. I do have some follow-up questions. I did want to
Sure.
clarify one point about the masks. We know that masks do reduce transmission of COVID, even cloth masks like this or surgical masks, but they don't reduce it. They don't reduce transmission to zero, even if worn correctly. So it's not always that we assume that people aren't wearing masks, but we know that even if they are, a cloth mask like this wouldn't 100% reduce the risk of transmission. And so that's why we still ask employees to quarantine, even if both of them were wearing a mask in most situations. Okay, so I have a question for you. So if an employee does need to quarantine, but they've exhausted all their 80 hours and their sick leave and their paid time off, what would you do in that situation?
They would just be required to be off work without pay.
And okay, thank you for letting me know. So I did want to mention to everybody that the health department does have resources available for people in that situation who maybe are worried about paying bills or having food if they're being asked to quarantine or isolate and they don't have a source of income, or even people who do have income but still are having trouble making ends meet. Just stating that you have a need is enough to receive this aid from us. So we do have food aid and we can help with bill pay. We have a variety of social services available. So encourage your employees to reach out to us in that scenario or any other scenario where they would have needs during this time. So I do have another question. Can you tell me about what you would do if you had an employee who had COVID symptoms, but they claimed that they were something that wasn't COVID? Like they have a runny nose and a sore throat, but they think it's allergies. What would you do?
Yeah, we've had a couple of cases like that where somebody says, every year at this time I get allergies and that's what it feels like. And so we've had them go to their doctor and be diagnosed with, their regular recurring symptoms. And if that's the case, then we have not required them to quarantine and we haven't done the close contact quarantine or anything like that.
Okay, yep. So just if a physician can confirm that it's not COVID and they can get a negative test, that helps a lot too.
Yes.
To stay at work. I did want to mention for the resources I mentioned before, employees can also call us at the 311 hotline to be able to talk to us about those. Okay, so one last question. Are you considering having your employees vaccinated for the flu?
Oh, right. That's what I forgot to say. As flu season's coming up, I'm a little concerned that people have symptoms, regular cold and flu, but are we going to be starting to quarantine a lot of people? What we did last year is we did offer flu shots to everybody at our location. And then if family members wanted to go, they could come here or they got a voucher to go do it elsewhere. And we'll definitely do that again this year. So hopefully eliminate extra symptoms that we have to try to figure out what the actual cause is.
Absolutely. Thank you so much for doing that. We would encourage everybody to look for flu vaccine solutions for their employees, especially as we are coming into the flu season. So Kate, thank you so much for being with us this morning.
No, thank you. You guys have been a great help.
Thank you so much. All right. Thanks, Kate. And now we're very happy to introduce our second speaker, Mr. David Staker from Plastic Packaging Technologies, which is a leading manufacturer of value-added flexible packaging products and services. PPT serves large food and pet care companies and brand owners throughout North America with flexible packaging. We're very happy that the CEO is with us today. Mr. Staker has been an attorney specializing in corporate law. So thank you so much for joining us. And would you mind sharing your COVID story with us this morning?
Sure, Haley, happy to do it. Appreciate the opportunity to participate, and hopefully our experience and journey will be of help to some, and I look forward to learning a thing or two as well, as always. We appreciate the public health department's assistance throughout this. Our HR team has probably been on the phone with someone at your office at least once a month over the last 6 months as we all try to navigate through this unprecedented time. So, going back, and I guess just as a little bit of context, so we operate manufacturing plants here in Kansas. We have a plant in Columbus, Ohio, about 400 associates, and we run 24/7. And through this pandemic, we have been very fortunate as an essential business. We are a producer, manufacturer of food packaging to food, medical health care, other specialty consumer industries. So our challenge has really been, making sure we keep our plants open and operational and our associates safe, knowing that if we were to have to quarantine a large group of people, we just simply couldn't fulfill our commitments to our customers. So, know a lot of people are hurting certainly through this pandemic, and we've been very fortunate. So, our three objectives going into this were, first and foremost, keep our associates healthy and safe, keep our plants open and operational, and then do everything we can to serve our customers and communities, and use this experience to really endear our customers to us. Back in late March, when the first shelter in place orders were implemented, I think the biggest issue we confronted practically was helping our people deal with the very natural feelings and anxieties and uncertainties around COVID. There was so little known at the time. And of course, we needed people to be here and working. So we initially implemented our disaster recovery business continuity plan. Of the roughly 50 folks that were in salaried and office roles, we immediately moved them to a remote work arrangement. We shut the facilities to outside visitors. We implemented our travel restriction policy, again, just to make sure we didn't do anything that might introduce the virus to the plants. To counter some of the, and frankly, promote and try to help people get through that fear and anxiety, we implemented hazard or hero bonuses. And certainly as we were waiting for the legislation to be enacted around emergency FMLA, we wanted to make sure our folks knew that we appreciated the sacrifices they were making and the courage that we were asking them to have to come to the facility. So, our first case, our first positive diagnosis, well, I should say, at that same time, as part of that business continuity plan, based on guidance from you all, the CDC, we implemented everything we could think of in terms of safeguards, practices, and protocols. Really, it was kind of like GMPs on steroids. So from socially distancing in our factories, really looking at our machine cells and saying, okay, how do we do this a little differently to make sure people don't come within 6 feet of one another? Again, because we knew that if there was a diagnosis, we would then have to contact trace, and potentially anybody who had close contact would essentially be required to quarantine and disqualified from working, which we just couldn't have that happen. So we enhanced cleaning sanitation procedures. At the start of all shifts, we staggered shift starts. Breaks and lunches, to the point you made earlier, we actually added a large 400 square foot tent outside of our facility, complement our existing break rooms, that breaks and lunches could be socially distanced with just one person per table. So a variety of things that we implemented. In addition, we started temperature and symptom screening. And then ultimately implemented a mandatory mask policy, I think beginning in June when the governor implemented that policy. We recommended that from the outset. I think the guidance was a little bit unclear, but ultimately that mask policy, we believe, has helped immensely. That first positive diagnosis was in early April. And when that occurred, again, just given the uncertainty as to how to respond, we shut the plant down for a 12-hour period. Again, and that was over a weekend, which made it a little more complicated. And I'll get to communication here in a minute. But we shut the plant down, did a very deep cleaning using the third-party subcontract cleaning service that we especially brought in. We quickly realized after the second positive diagnosis in mid-April that we just weren't going to be able to shut the plant down every single time there was potentially either a close contact or a positive diagnosis. So we began implementing a weekly plant shutdown for 4 hours where we did a deep clean in addition to enhancing shift start procedures. So, as soon as we had a positive diagnosis or learned of that diagnosis, we did do contact tracing. Our HR department's been great working with our supervisory teams to determine who might have been within close contact and then asking those people to quarantine. And fortunately, those quarantines have been relatively few. Since early April, we have had a total, between the two plants, a total of 12 positive diagnoses, a majority of those here in Kansas City. I can tell you with almost, 99% certainty, although you just don't know how COVID is transmitted and contracted in every case. But based on our contact tracing, we felt very comfortable and confident that most of those, if not all of those cases, came from outside our facility. We didn't see any transmission among or between people internally with the masks and all the safeguards we had in place. So we've now been 3 weeks without an active diagnosis. And again, the biggest challenges I think have been, obviously we've kept people safe, but there is a lot of fear and anxiety. People are exhausted. The adrenaline our adrenaline has not kept up with the length of this pandemic. So I know that's a big factor. We are asking people to work a lot of hours. Kate Webb mentioned something about confidentiality and obviously the HIPAA laws. What we found is when people heard about a diagnosis, they wanted to know everything. And so obviously we can't share that kind of information with them. And so we found that communication along the way was really important. So we have a weekly COVID update where we help people understand, is there an active case? Is there not? And make sure people know the protocol, that we will alert them. We will personally speak with them if we determine that they have been in close contact. So lastly, I guess, and Kate touched on this as well, but today the challenges are really, as we were, getting into the seventh month of this, really dealing with, the challenges relating to childcare and school, and making sure that we work with our associates to provide as much flexibility as we can so that they can maintain their jobs and also care for their families. And so, those are some of the challenges that I think we've moved to. But again, you all have been a great partner and appreciate your support of our efforts.
Well, thank you so much, David. I did have a couple of follow-up questions. So you mentioned about masks. I wanted to ask, what kind of masks are your employees wearing?
Yeah, so we provided back in April every associate with a cloth mask, a 3-ply cloth mask that complied with the CDC guidance at the time. We have encouraged our associates to bring their own N95 masks if they have them. We have strongly discouraged the gaiters or the neck gaiters, I guess. As we understand, those are not as effective. But I will say that everybody has been, even in the office, once we began bringing some people back in June, we applied even our mask policy, mandatory mask policy, to folks in the office while they're in open office settings or in common areas. And we really haven't had much pushback. I think as we've educated folks on the virus and how it's transmitted, everyone has been very receptive to it. Our plants, we do run 12-hour shifts. The plants are climate controlled, but it's still a nuisance certainly, and it gets hot, but folks understand the need for it.
Awesome. Thank you so much for those answers, and thank you so much for sharing your story with us. We certainly appreciate your continued communication and all the information sharing that you have provided us with, and we are grateful for your partnership moving forward. So thank you so much, David,
Thank you.
for working with us. Thank you. And so I just wanted to thank one more time Ms. Webb and Mr. Staker for your time this morning. And now I'll turn it back over to you, Nicole.
Thank you, Haley, and thank you again to both Kate and to David. So I'm going to go ahead and share my screen again. Hopefully you all can see my screen. Now this portion, we're going to actually get into our frequently asked questions. And can you all see my screen? You can. All right, great. And so our first frequently asked question is, when, as an employer, when should you send an employee to get tested? And I'll actually turn this over to, or ask this question to Haley.
Okay, thank you. So that's a great question. If you are symptomatic, especially with those symptoms we mentioned before, please send your employee to get tested immediately. They can come and get tested at the health department from 9 to 3 for free. We're at 619 Ann Avenue. There's no proof of insurance required, no proof of immigration status required. You can just have them come and get tested here with us. However, if the person was exposed to coronavirus, like you mentioned before, whether at work or outside of work, we ask that you wait for 7 to 9 days after the time of exposure for them to come and get tested. And the reason for that is because the likelihood of a false negative test, that is a negative test when really the person does have coronavirus, is particularly high before 8 and after 8 days after the exposure. So the likelihood of a false negative test kind of dips like this. The lowest point is at 8 days. And just as a word of caution, even at 8 days after exposure, there's still a 20% chance that a person could get a negative test when in reality they do actually have COVID. So it does take a certain degree of logic as well to think through, well, if this person is having shortness of breath, trouble breathing, chest pain, fever, vomiting, muscle aches, and they test negative, chances are high that that's probably a false negative. And that's another one of the reasons why we ask people to stay home for the full 14-day quarantine, even if they do test negative, because of the chance of those false negative tests. So again, please have your employees come get tested 5 to 7 days after their exposure, even if they don't have any symptoms. And if they do have symptoms, they can come and get tested right away.
Thank you. And I believe Dr. Corvo is on, but I believe she's having some technical difficulties. So, Janelle, I don't know if you can maybe possibly fix that. But our next question is, should an employee get retested? And Dr. Corvo, can you hear us or can you get on? If not, I'll turn that back over to Haley. Sounds like she probably can't. So I'll just turn it back over to Haley. Go ahead, Haley.
Sure. So if an employee has tested positive, we actually don't recommend sending them to get retested. The reason is because, as you might have heard, people can test positive for coronavirus for several months. They might test positive and then wait a couple of weeks and then go and get tested again, and then it turns out that it's positive. So why is that? The reason is because the coronavirus is detected by a test called PCR. This PCR test detects pieces of the virus, but it doesn't tell if there is a whole virus that is capable of infecting other people. It just tells us that there's pieces of the virus that are in a person's body. And so the positive test, we think, that happens later on after the person's initial first positive test, when they get tested positive later, it's not because the person is still contagious or infectious of others, it's just because they still have pieces of the virus that are setting off the positive test. And so put another way, once you have had your initial onset of symptoms and 10 days have passed, then you're no longer contagious to others, although you may continue to test positive. So there's not much value in going to get another test because it will probably be positive, but you are not able to spread the virus to other people, so you should still be able to come back to work. In the case that a person does not have any symptoms and they test positive, which does happen, then we just ask that you wait 10 days after their positive test. At that time, they can come back to work. And so we just ask that you not send people to get retested if they tested positive. In the case that a person has tested negative, if it's during that 14-day quarantine period like we discussed, if they have no symptoms throughout the quarantine period and they test negative 7 to 9 days after exposure, then you don't need to have them get tested again to come back to work. That's fine. If an employee has gone through this process once and then there's a new exposure or they develop new symptoms, then by all means, you can have them come and get tested again. That's no problem. But please, we just ask that if an employee has tested positive once, that you not send them to get retested.
Thank you. Our next question is for exposed employees. If an employee
In case that I wait 10 days after their positive test, after they've tested positive. In case that a person has tested negative throughout the quarantine period and they test negative, that's fine. Then if an employee has tested positive once, that you not send them to get retested.
Sorry, sounds like we're getting a little feedback there. Got to love technology. So the next question is for an exposed employee. If an employee gets a negative test and the results come back, can they come back to work immediately? Can you answer that question?
Hi, everybody. I'm happy to answer that question. This is Erin
there's-
Corvo. Yeah, hi, everyone. I'm sorry I was having such difficulties earlier. So I'm the Deputy Health Officer here at the Health Department. We really want people to remain in quarantine for that full 14 days. And the issue is even though we have a negative test, sometimes our tests are not totally 100% accurate. The other thing is that we know that this virus is spread super easily. So if you really have been in contact with somebody who tested positive for the virus, we absolutely want you to stay in quarantine for the full 14 days. And you may say, well, why actually get tested? And it's still important because if you were to come up positive, then what we would do is trace all those other people that you've been around. But just to be safe, we want to keep you in quarantine for those full 14 days to be sure that you then don't come back to work and expose others.
Thank you, Dr. Corvo. The next question is, do I need to shut down my business and get everyone tested? Would you like to take that one, Dr. Corvo?
Actually, I think I'm going to pivot over to Haley, one of our epidemiologists here, as she has been talking with a lot of the businesses who, are experiencing positive cases.
Sure. Thanks, Dr. Corvo. Thanks, Nicole. Likely the answer is no. Only close contacts of the person who tested positive need to quarantine. So the little diagram in the bottom is not a good diagram, but essentially, let's suppose that you are a restaurant owner and one of your wait staff tests positive. And this particular member of the wait staff stays in their section of the restaurant doing their work most of the time. They're doing their best to stay socially distanced from the cooks, from the hostess, from the managers, and from the customers. And so in that situation, there's no need to shut down your business if that particular employee were to become ill. They would just need to go home and follow isolation guidelines, and you would ask them about close contacts with the other employees. In the case that, let's use the same restaurant example, suppose that you had your hostess test positive, and let's suppose that this particular hostess actually was in contact with most of the wait staff on the days that he or she was working, and maybe not with the cooks working in the back or with the management staff, but with the wait staff, then anybody that this particular hostess was in contact with would need to go home to quarantine. But if you had other staff who could come in and work, then you could still remain open. So you really just should do contact tracing and then determine how many employees remain after you've done contact tracing that are not exposed and not symptomatic who could come and work. And if you have enough to keep your business open, by all means, remain open. Just make sure that you get it cleaned after discovering that you had a positive employee, especially if that employee was symptomatic while they were at work.
Thank you, Haley. All right, can an employee require an employee to get tested? And I'll actually turn that over to you too, Haley.
Thanks, Nicole. No, unfortunately, you cannot require that your employees go and get tested, but you can require them to stay home or not come back to work for the duration of their quarantine or isolation period, as we described earlier.
All right, thank you. Okay, how can I get a letter or proof of test results for my employee? And I'll actually turn that question over to Dr. Corvo.
So thanks, Nicole. We can issue those letters for you. And so if you need that, we're happy to respond. Please just call over to our office. You can see the direct line there, and we can confirm the test result and then send a letter to you directly. We've also started a program such that if you were to test negative, we're sending out text messages, and if you can't get a text, we can also call you directly as well. So we want to make sure that everybody's getting their results in a very timely manner, and we're getting results to people within a day or two of testing. So I think we're doing okay on that. Thanks.
Thank you. I think this is our last frequently asked question, and this question is also for Dr. Corvo, and the question is, can I just follow the CDC guidelines and be okay as a business?
Well, it's a good question and a little bit complicated. We do a lot of research here at the health department and look at guidelines from the CDC and KDHE and other health entities and such. A couple of the things that CDC has come out with have been really, really good, and we've adopted those at our health department as well. And some things that they've put out, we actually don't feel like they're appropriate. For instance, recently the CDC came out with this recommendation that maybe it wasn't the best thing to test contacts of positive cases. We don't believe that that's true. We think that it's really very important to test people who have come in contact with positive cases. Another example is sometimes the CDC says, well, even though you've been exposed or are positive, if you work in a really important, necessary job, that you can come back to work sooner than your isolation period or your 14-day quarantine. And, in those cases, you really just have to talk to us at the health department. We take each one of those into account individually, and we really only allow people to go back pre-finishing their quarantine timeframe if they're in a healthcare entity and they're not able to do full appropriate patient care. They don't have the number of people that they need to take care of people in that case. So it's extremely rare that we allow this scenario, and in fact have maybe only done it once or twice during this whole pandemic in very dire situations. But again, we want to talk to you directly about that. So if you feel that your business may apply, we're happy to field those questions. Thanks.
Thank you. And actually, I said one more question, but the last question is expectations to the 14-day quarantine. Are there any for any essential businesses? And Haley, did you want to take that question?
Thanks, Nicole. Yep, so just like Dr. Gorbo had just said, we are only allowing exceptions to this quarantine period for direct healthcare providers and in some cases emergency response services. But again, this is really rare. And again, we ask that you call us and discuss your situation with us. But if not, we just ask that you assume that you should send any exposed employees to quarantine for their full 14 days and not bring them back before the end of that period. Thanks.
Thank you. That concludes our frequently asked questions portion of the town hall meeting. And I'm going to actually turn it over to Janelle Friesen, our second moderator, who's going to go over in detail resources for employers and employees and discuss some of those options for you.
Thanks, Nicole. Good morning, everyone. Yes, I'm going to go through a few different resources for employers as well as ones that you can direct your employees to. For this first one, a new initiative called Keep WICA Well, I'm actually going to hand it off to a guest we have on here with us, Alan Carr, who's with the KCGA Convention and Visitors Bureau, which is one of the organizations that is coordinating this initiative. So Alan, do you want to just take us a minute to explain what this initiative is and what that means for businesses in WICO?
Absolutely. Thanks so much for giving us a little bit of time to talk about this initiative. So one of the things I think, this is a partnership between 3 business-focused civic organizations here in Wyandotte County, our organization, the Convention and Visitors Bureau, the KCK Chamber, and the Wyandotte County Economic Development Council. And I think one of the things that we've recognized is businesses that are open and taking precautions, there's still some consumer confidence issues. Consumers are sometimes unsure if it's safe to visit businesses and what businesses are taking the proper precautions. So this initiative is a way for us to tell the public that businesses are taking this seriously, and Wyandotte County is taking this seriously, and it's safe to patronize businesses that are taking proper precautions. So we are offering the opportunity for businesses to take a pledge that they are going to follow the guidelines from the local health department and their industries specifically to keep their businesses safe, that they're taking proper precautions. We've created this website, keepwycowell.com, where businesses can go on and take this pledge. And the businesses agree to just follow some simple basic guidelines that have been outlined by the health department. Transmission barriers between the employee and the customer, increased sanitation and cleaning of the business, employee screening procedures, as some of the things you've heard today, as well as any other industry-specific guidelines. This program is free. And then our organizations will keep this list that anyone can go to, and then we'll be implementing this in the marketing that we're doing to our customers, to the public. So, you know, on the tourism side, we know those consumer-facing businesses, whether you're a restaurant or a shop, this is a way for us to spotlight those businesses that are doing the right thing to keep consumers safe, so that we can really help businesses get customers back to your business as there's enough other challenges going on. We want to make sure that the public knows that the companies that are taking the right precautions.
All right, thank you so much, Alan. And if you all have questions about that, you can type those in the Q&A. Let's move on to the other resources. So some of you may have heard about implications for businesses through the CARES Act. We're not going to dig into the CARES Act in great detail today, but there are a couple links. There's a link through our website where you can look at, there's a working group that's looking at how CARES Act dollars that have been allocated locally are going to be spent, and there's a few different phases of that. We're going to be going into another phase of those funds. There's also just some general information there where you can look into that more. There's some things in the CARES Act pertaining, for instance, to we've talked about the 80 hours of paid leave for employees for quarantine or isolation, and some of that is linked to the CARES Act. So if you want to learn more about that, you can take a look at this. And we will make these slides available after the presentation, so you'll be able to refer back to this. All right, let's go on to the next one. Some resources for employees. A lot of people may have been going through some ups and downs in terms of finances and other things. Some people, maybe someone has, even if it's not your employee, maybe it's someone in their household, there's someone close to them that has lost their insurance. They can go to healthcare.gov if they need health coverage. Additionally, we mentioned 311 earlier. If you're within Wyandotte County, you can just dial 311. If you are calling from outside of Wyandotte, you need to dial the full number that's listed there. They're prepared to answer a wide array of questions about COVID-19. Some of that is just general questions like, hey, where can I get tested? Some of it could be medical questions, and they could connect you to a health worker who could talk to you about that. And then there are also community health workers who are trained to walk people through the process of getting assistance, like if they need food assistance, if they need help paying their bills, and employment, etc. They can call that number for help, and they'll be connected to someone who can walk them through that. Also, there are folks who are prepared to answer a lot of questions for employers as well. So that's not exclusively a resource for individual residents. So if you have some general questions about your business, you can call 311. All right, let's move to the next. Okay, I am going to share my screen so you can take a look at our website, which is wicokck.org/COVID COVID-19. And that's our main COVID landing page. So when you get to this page, this is kind of your spot if you're wanting to find any information about COVID-19. So if you wanted to find information about the latest data on COVID in Wyandotte County, you click on the COVID hub. If you want to know where there's testing available, you can click for the testing info in English and Spanish. There's a foods needs request form. We mentioned food assistance is one of the things people can access through 311. They can also get that on here. Businesses have, there's a specific business assistance section that goes through some local resources like some FAQs, a toolkit, etc. And there are state and federal resources as well. Some of these do involve financial resources. Some of them are more informational resources and tools for you. There's also some general resources that some of them may pertain to businesses. A lot of them are more for individuals. And this Restart WICO tab is pertaining to lots of different things with reopening with activities, you know, since the stay-at-home order, what has happened since then. This also has a link to that CARES Act information that we mentioned earlier. So this is a good spot if you're just wanting to find out a little more information to go to this website to learn more. Again, that's wicokck.org/COVID-19. All right, that is the end of our presentation. So we're going to move on to the Q&A section now. We have a few questions that were submitted ahead of time, as well as folks who have been putting questions in the chat during this. So there is a question. One of our first questions was that someone's saying that they still can't get all of their team members to take this seriously. They've had issues with them either coming to work sick or coming to work with a positive COVID case in their home. They're re-stressing screening at the beginning of each shift. They have mandatory mask wearing. What else can we do? Help. So Haley, do you want to speak to that? And then Dr. Corvo, if you want to chime in as well.
Yeah, thanks so much, Janelle. So we recognize this is a really stressful situation, and we're sorry that you are having so much trouble encouraging your employees. And I think stressing screening at the beginning of each shift is awesome. Stressing mask wearing is awesome. Making mask wearing mandatory is great, and that's what you're already doing. Another thing you might consider doing when you communicate with your employees is showing them the statistics that are available on our WICO Hub website. We show how many cases that we have in total in the county. We show the case rate per 100,000. And interestingly, our case rate per 100,000 is worse than New York City, which is a place where, I mean, most people know that that was where the beginning of the pandemic really hit hard in the US. And so in terms of like cases per 100,000, we're doing worse than New York City is on average. For example, we're doing worse than Italy is as well. Most countries in Europe are doing much better in terms of case count per 100,000 than we are. And so just showing people the statistics might help. You might also consider encouraging people to read the news or posting information, you know, from news outlets about coronavirus around the country, how it's spreading, especially in the Midwest nowadays, and just kind of trying to share those stories of how coronavirus is really affecting real people around them, with both statistics and stories from the news might help. Dr. Corver might have some other ideas as well.
That's a great question, and I don't know that I have any super brilliant ideas on it. I think that our community, unfortunately, is experiencing a lot of COVID fatigue. I can tell you that this is a really tough job within our health department as well, and everybody just kind of wants to get back to normal. But of course, we just can't yet, you know. I guess one of the things that I think about is instead of, you know, we've been beating people over the head a lot, you know, about driving home these fear tactics and, you know, be careful and that kind of thing, which is for a reason. I mean, I think as Haley said, you know, it actually is incredibly impressive, the amount of community spread we have here in the Kansas City region. And that being said, there are also other ways to motivate people. And I think about motivation based on reward and other positive tactics. And so I guess I would encourage you as a business leader to consider how you can reward your workers for taking special precautions, both at work and in their lives outside of work and such, so as to not put others at risk. You all are more creative than I in coming up with that, but I think we're working a lot with our schools and such to consider those types of positive rewards as well. So thanks for that question.
All right, thank you. I'm going to direct another question to Haley. Well, combining a couple of questions, it sounds like people want a little bit more clarity on what it means for someone to be a close contact, or what it doesn't mean to be a close contact. I know we've talked about it a little bit in here, but just to kind of get some further clarity on it. So part of it is just reiterating if masks were worn, what that means for whether someone's considered a close contact. And then, are there any examples of what would be not considered a close contact in terms of, amount of time someone was around someone who later tested positive? So that's kind of a two-parter.
Okay, so here's some examples. Thank you, first of all, thank you so much for that question, Janelle. This is a great question. So let me try and walk through some scenarios. So let's say you arrive at work and you see Jim on the other side of the hallway, and you guys are both wearing masks, and you say, "Hey, Jim," and Jim says, "Hey, Janelle," and then you guys go into your respective offices. That's not a close contact. Let's now suppose that interaction happened when you guys were 6 feet apart, or closer than 6 feet. "Hi, Jim. Hi, Janelle." You guys don't touch. You just say hi. It's a very brief interaction. That's not a close contact. So any kind of interaction like that is not a close contact. If now I say, "Hey, Jim. Hey, Janelle," and Jim is coughing, and then Jim and I hug while he's coughing, that wasn't 10 minutes, but we would still consider that close contact because you had direct physical contact while he was coughing. Even if both of you were wearing masks, that's an exposure. But those kind of things are pretty rare, especially I think people are pretty aware nowadays, and that kind of thing is hopefully not happening, but if it did happen, that would count as an exposure. Let's say that you go to the market over in Kansas City, Missouri. You go to the market where they have all the tomatoes and vegetables and stuff, and you walk around in the market. You're doing your best to stay distance from people, and across the market somebody coughs, but you're not within 6 feet of that person, then that's not a close contact. There's an infinite number of situations we could run through. I think if you are in doubt, then you can either give us a call or just err on the safe side of considering it close contact. I feel like most work situations, like let's say that my chair is exactly 6 feet away from the person next to me. Our chairs are positioned exactly 6 feet apart, and the person next to me ends up testing positive for COVID. Then I think it would be kind of a question you would have to ask the employees, like, did you actually remain 6 feet apart all the time? Or because you were sitting together all the time, did you sometimes lean across their desk, or they leaned across your desk, or you guys would talk to each other a lot? Even if it was exactly 6 feet, but you guys are sitting together all the time, then I would count that as a close contact. If you can make it so that their chairs are more than 6 feet apart, then you don't have to wonder about it. So I hope I'm not rambling too much. There are many situations it could be in, but just if you are counting minutes to try to figure out if it ended up being 10 minutes or not, and you end up at something like 8 minutes, I would count it as a close contact. With regards to the masks, like Janelle was saying, the gaiters are not very effective. So gaiters are not super useful. They're better than nothing for sure, but we wouldn't recommend them for your employees. Just same as like handkerchiefs, we wouldn't. These like 3-layer fabric masks are not bad. The surgical masks are also not bad. They don't reduce transmission to 0. Eye coverings are also important. If your employees can have glasses on or safety glasses, that also reduces the odds of transmission. The best way to protect yourself mask-wise is with an N95. But we know that those are sometimes hard to get and can be expensive, and there's availability issues. But in the case that 2 healthcare workers were wearing fit tested N95s and one of them had coronavirus and the other one didn't, and they were closer than 6 feet, we wouldn't count that as an exposure because they're wearing fit tested N95s. So that's kind of the gold standard, but we recognize that that's not possible for a lot of businesses. I hope I answered that question.
Yeah, that helps. And like you're saying that the other type, most masks aren't nothing is gonna 100% prevent all possible transmission, which is why it'd still be a close contact. However, the data is showing a significant reduction in that risk from any type of mask. Is that correct? All
Yeah,
right.
any type of mask is better than no mask. Absolutely.
Okay, I was going to direct this next question to Dr. Corvo, but she unfortunately had to step away. So Haley, I'll direct it to you, and then if we need to follow up on anything, we can do that later as well. But there's somebody who has businesses with locations around the country and is wondering if the 7 to 9 day after exposure is a standard timeline for testing, and they're getting questions about that regularly since they have locations outside of Wyandotte.
Sure. Thank you so much for that question. We are using a research article. I want to say it was published in the Lancet, but I have to check. This is an article. It might not be the Lancet. It just came out, I think, within the last 2 weeks, certainly within the last 10 days. And this is an article that was published, and I don't know where they did the study, but they used some multiple hundreds of people with coronavirus. And they tested them to try to figure out when the likelihood was highest they would get a false negative. And so this is like a compiled study of data that we are basing this on. And so although across the country, not every health department might be referencing that study, we found it to be a viable study that helped us inform this policy. And we think that if you have the power to ask employees to do that in other places, it should also apply to them there. We don't think COVID would spread like that false negative rate would be different in Kansas versus in New York because the PCR tests aren't different.
Okay, let's move on to our next question. So Haley, when a person who tested positive for COVID has finished their time away and they're given the green light to come back to work, is there anything that we or the employee can do to help others be more comfortable?
Yeah, this is a really great question. I think a lot of employers have this on their mind. And my advice, just like David said, and just like Kate said, and as Dr. Corvo said, is communicate. Tell the employees that after 10 days, people are not contagious. There's no issue with them coming back to work. I can send you out links. There's a big CDC page where they list all of the research that backs that up. You can print out and send your employees links to this page. You can print out and send them links to this article or excerpts from this article that state that clearly. The science backs that up. Encourage people to continue wearing masks and socially distancing all the time because they never know if somebody could be, asymptomatic and carrying the virus or not. So just continuing to constantly communicate with your employees about COVID and make sure that they know that you are making these observations based on what we're telling you and that we're telling you them based on the data. Telling people to come back to work 10 days after their onset of symptoms, we didn't just make up that number. That's based on studies that are published, and we're happy to send you those if that's helpful. And just encouraging people to keep wearing their masks all the time, socially distancing, that's the best way to protect themselves.
And so when someone returns to work, they still need to wear those masks and do that social distancing as well, right?
Yeah, absolutely. We think we are not sure if you can get coronavirus more than once or not. It looks like maybe you can't, but it's still too early in the pandemic to really tell. There was an article that came out about a man in Hong Kong who was infected twice with COVID with 2 different strains that were, I think, about 3 to 4 months apart. So maybe it's possible to get COVID twice, but the jury's still out on that one. And so just to make sure that everybody is protected as much as possible, please continue to wear a mask, even if you have had COVID and have recovered. Please continue to wear a mask and remain socially distanced from others.
All right. So another question that we got ahead of our event today was, what are what are companies doing to address attendance and health and managing that in the current environment?
Sure, thank you. So I think a lot of companies are offering paid COVID leave to employees who need to isolate or quarantine at home per the CARES Act. You can check out the CARES Act in the PowerPoint. There's a link there. You can Google the CARES Act and check it out. Some are allowing employees to use paid leave or sick time to be able to stay home. But the most important thing is that if an employee calls in sick or they show up and they are sick, that they be able to isolate at home. That's really key. And that they can be encouraged to go and get tested, although you cannot require them to get tested. And once again, our 311 line is available if employees are worried about paying their bills or having food to eat, supporting their families. There are some of those things that we can help with. So please share that 311 line with your employees. They can call us and we can get them connected with community health workers in that scenario.
Great. And as far as connecting people to resources like that, we also got a question about what are UG, WICO, and Kansas sites that delineate recipients of assistance. I'm not sure if they're getting at some specific type of assistance, but as far as the assistance that we've mentioned here, is there any delineation on who in our community can receive those?
No, we don't ask for any proof of income, proof of immigration status, nothing like that. You calling us and letting us know that you have a difficulty is what we base our aid on. So in other words, aid goes to anyone who says that they need it.
All right, and now to a social distancing question. We've had a number of discussions about things like if you're outside versus inside and being 6 feet apart, and someone was saying if employees are working inside on a dock and are socially distanced, do they have to wear a mask? Would this be similar to loading trucks outside?
Thank you for that question, Janelle. That's a great question. I think a good rule of thumb to be following is that if you're inside, you should be wearing a mask. The only exception would be is if you're in a room alone, as we all are now in our own offices. No one else is in here with me, so I'm not wearing a mask. But a good rule is if you're going to be inside, you should have a mask on.
Apologies, I had a technical issue for a second. All right. We have time if people want to type any additional questions. There's also some questions that had already been answered that have been typed in that you can review. But here's, this may be our last question if people don't enter anymore.
I actually had a question, Janelle, and it's just a simple question. Can you just explain for those who may not know the difference between, Haley, isolation and quarantine?
Yeah, absolutely, Nicole. Thank you. Isolation is for people who have tested positive for COVID and or who have many symptoms of COVID, even if they've gotten a negative test or if they're waiting to get a test. So those ill people are isolating at home for 10 days. So ill, isolation, they both start with an I. Quarantine is for people who are in contact with someone who has tested positive. So quarantine is for contacts. That kind of sounds the same, but not really.
Thank you for that distinction.
All right. We did just get asked if the webinar will be posted online. Someone's had some internet connection issues. Yes, we will post this online. So we will post the actual recording of the webinar as well as the slides. Okay, another question here. Haley, what response would you give to small or medium-sized businesses that are already under stress, whether financial or emotional, to keep their business afloat when all the information may seem overwhelming? Quarantine, isolation, employee pay, testing, negative, positives, city regulations, health department recommendations, and so on. So what response would you give to those businesses?
Thank you for the question. I think this is a really good and tough question. I know a lot of businesses in the county are really struggling, and we just thank you so much for all the work that you're doing. You know, what you're doing does make a difference. Anything that you do is helpful and does make a difference. So thank you for all your hard work. So I would say in terms of all of the different guidelines. Part of the reason we had this seminar was to kind of help put all those guidelines into one place. There was a slide about employer resources that Janelle had posted that you can use. You can use our website to look for other employer resources. But please rely on us, lean on us to help you. If you have any questions, you can put down, the phone number, the 311 line number, or my office number, and just call. If you have a list of questions, how are we supposed to do this and this and this? It's our job to walk you through the answers insofar as they pertain to COVID. With regards to the financial side, unfortunately, this presentation is more geared toward the health side, and we are unfortunately unable to give legal advice or financial advice other than to relay you to the CARES Act website and to look at that for more information about the CARES Act. Again, we have resources for employees who might be struggling because they are not able to be paid. And we would just encourage you to use the resources that we posted on the other slides. And you can also contact Keep WYCO Well to determine if there are other resources that they can provide during this time. So in summary, please just give us a call with any questions that you might have, and we'll be happy to try to walk you through those.
All right. Thank you so much, Haley. So it sounds like we need just a little bit more clarity on quarantine and isolation, and specifically when it's safe for somebody to return to work. So someone is saying if somebody is tested positive, they've already stayed home for the recommended amount of time, when is it safe for them to work around others? People are concerned about risk and exposure. So Haley, if you could explain, well, again, what the isolation guidelines are after someone tests positive, and why. Why is it that we would say that after they have met those criteria that it would be safe for them to return to work?
Sure. Thank you so much, Janelle, for the question. So again, if a person tested positive for coronavirus, the evidence shows that for the vast majority of people who just have moderate to mild symptoms, maybe moderate to mild can be interpreted as they did not have to go to the hospital for their symptoms of coronavirus, felt like the normal flu, the normal cold. Those people are no longer contagious 10 days after their onset of symptoms. And so that's been proven or at least supported by many studies of hundreds of people who have tested positive for COVID, and they've taken samples from those people from the inner nasal cavity of those people when they do those nasopharyngeal swabs. They take samples and they try to use those samples to infect other cells, and they're unable to do so after 10 days. So, I'm sick with COVID, I've just started having symptoms. They take some of the virus and they use it, and they realize that it can infect other cells, and they do this every day. And then at 10 days, they realize that there's no more infection going on. And actually, I think for most people, it's really 6 days after the onset of symptoms where most people are no longer infectious. And then 10 days, they couldn't find anybody that was infectious. I think with the exception of one person in many hundreds of cases. I don't have the exact number in my head. So that's where that information is coming from. So again, 10 days after your onset of symptoms, you're not contagious for COVID. And so you're able to come back to work. The only exception in this case would be somebody who is still ill at that 10-day mark. Like they're still very ill, they're still vomiting, they're still having chest pains, they're still at home, then they have not had a significant improvement in symptoms. And so they may still be contagious and they're not fit to come to work anyway, so they should remain at home. I'm so sorry. Yes. So part 2 says, should that person be retested? I know that it seems logical that it would make sense for a person to be tested several times until they get negative to come back to work. I understand the logic behind that way of thinking, certainly. And I know that there are a lot of different advice, different pieces of advice kind of coming from every direction. But again, we know that people can test positive for coronavirus for months after their initial infection, after that initial positive test. But that doesn't mean that the person is still infectious or able to give the virus to other people. Really, what's popping up, what's causing that positive test are pieces of the virus that the PCR test detects. So it's like the PCR test is detecting, imagine that, this is a horrible analogy, but imagine that coronavirus is like an elephant. And the PCR test detects like the legs of the elephant. And so if you do a PCR test and the test comes back like, oh, there's elephant legs, then the test is positive for coronavirus. But it doesn't detect if there's a full elephant. It just detects if there's the legs of the elephant. After a certain amount of time, the virus, there are certain particles of the virus that remain in your body. They're like the legs of the elephant, and the other pieces of the elephant kind of broken up remain in your body, but only the legs is not a full elephant. So it cannot infect another person. Although the test will still say there's an elephant, but it's only really detecting that one part. And I hope that analogy kind of made some sense, but you might continue to test positive, but you're actually not still infectious. It's just saying, oh, there's still virus there, but really it's just pieces of the virus that are still there that aren't able to infect other people. So in summary, 10 days after the person starts having symptoms, as long as they're fever-free for 72 hours, they have significant improvement in symptoms and they're not actively suppressing the fever with Tylenol or ibuprofen, they're good to come back to work and they should not be retested. Whew. Hope that answered the question, Janelle.
Yes. Go ahead, Nicole.
Now, I was going to say, and to summarize that, if you do test positive for COVID and after your 10 days, you're no longer infectious, so asking an employee to get retested, it's really redundant and not a good idea because they could in fact test positive, but they're no longer infectious. And so they're going to test positive again, and trying to get another negative test or to get a negative test is really may not be possible. And so you want that person to come back to work and they're not infectious. So I think that's what Haley was trying to say. So are there any more questions before we conclude our town hall meeting? We'll give you just one more minute to type those questions in before we wrap things up. Well, again, I want to thank all of our panelists. Great questions for our first town hall meeting. We will be sending out a survey asking you for future topics and also how this town hall meeting went. And again, thank you for all feedback, future feedback. And then also our next town hall meeting will be September 22nd. That will be done in Spanish. So stay tuned for that. And this does conclude our town hall meeting. And so again, we thank you and have a great rest of your day.
We did get a last minute.
Oh, we did. Okay, I'm sorry.
That's okay. Just to confirm, is it considered close contact if two employees work 6 or more feet apart with masks, but one is positive?
Yes.
So we do have a few more questions before, and we're still early, so we won't wrap up until we answer those questions. So.
All right. This one I wanted to ask Haley. Can you remind folks if they come to get tested at our health department, who can get tested at our health department?
Great question. Thank you very much for this question. Anybody who lives or works in Wyandotte County can come get tested at the health department. So that's the first thing. Please, when you come to get tested, bring either your ID that has your address that shows that you live in Wyandotte County, or a piece of paper from your work or your work ID that shows that you work in Wyandotte County. And this can be as simple as a paper on letterhead, Plastic Packaging Technologies letterhead. I assert that this employee, John Smith, works at Plastic Packaging Technologies, signed David Staker. That letter should be good enough for you to be tested in Wyandotte County. Second thing, if you come to get tested and you say that you were exposed to coronavirus yesterday, you will not be able to get tested because, as we said, the chance of a false negative result is really high immediately after you're exposed. And so you got to come 7 to 9 days after you've been exposed to be able to get tested. If that falls over a weekend, we're not, we understand if that day falls over a weekend, you couldn't get tested over the weekend. That makes sense. Err on the side of coming after the weekend rather than coming before. Like if you have to choose between coming, 6 days after your exposure or 10 days, I would say come 10 days after your exposure to get tested. So let's back to the beginning. You need an ID that proves that you live and work in Wyandotte County, live or work in Wyandotte County. You can live in Johnson County and work in Wyandotte County and still get tested in Wyandotte County. You just need proof that you work here. Second, you had to have either been exposed 7 to 9 days ago, or you have to be having symptoms of COVID. And so you can check on the CDC website. Many of those symptoms are listed. Anything from runny nose, sore throat, cough, chest pain, diarrhea, nausea, vomiting. Loss of taste and smell is a big one for COVID. That's like one of the key. although not everybody that has COVID has loss of taste and smell, that one is really strongly associated with COVID. And it's a really odd one that isn't associated with a ton of other common illnesses. I guess mono also causes loss of taste and smell, but most people, anyway, I digress. So I hope that that was a good summary. So either contact with someone who had COVID or you have symptoms, live and work in Wyandotte County. Please come and get tested here.
Live or work in Wyandotte County.
Live or work.
Yes. And our testing is Monday through Friday, 9 a.m. to 3 p.m. And we're just one of the testing sites available in Wyandotte County. If you go to our website or call 311, you can find there are pop-up testing sites that are coordinated by the Wyandotte County Health Equity Task Force, Vibrant Health, and Swope Health that do testing at multiple sites around the county. There are stores and pharmacies and such that have testing, some clinics, so you can find other opportunities there as well. I also wanted to mention, I know a lot of you maybe have sites around the metro area, or people who, you know, they might live or work in KCMO or, you know, in another part of the metro area. You can go to a site for an initiative called Come Back KC, which has resources for testing locations around the metro. So if you don't qualify for the Wyandotte County site, you also can text Test Me, that's all one word, to 1-833-382-0252, and we can share that with folks. You know, type that up later if you want, and you can, if you tell them what county you live on, it'll direct you to resources on testing. And then we do have a couple more questions coming in. We have a few minutes left. We will need to wrap up at 10:30, but let's see what we can get through before we go. And I can take this next one. What can we do if we go to a business and they're not demanding masks? Let people walk in the business with no mask, etc. Well, there are masks should be required at any business in Wyandotte County. We do still have a mask order in place here. So if people are outside of their home and they're not, with a few exceptions like socially distanced, you know, outdoor exercise, if you're walking at the park or something, that would be an exception. But if you're at a business, if you're at work, anything like that, masks should be worn. So with that, there is a place you can submit complaints regarding the mask order. So on our website, again, wykokck.org/COVID-19, under that Restart WYCO tab, there's a button there that you can click to submit a complaint that goes directly to community policing. So that's where you can submit that. And it looks like we have another question as well. If we're asking for them to test 7 to 9 days after direct contact and they test positive, obviously they're in isolation, how do you determine their close contacts at work? They wouldn't have any because they've been in quarantine. So Haley, can you speak to that?
Yes, ma'am. Thank you very much for that question. That is absolutely correct. They would not have any close contacts at work because they would have been in quarantine, which is awesome for you because now there's no one else at work that you would have to send home. So that's exactly right.
All right. We have somebody asking about if they see somebody having a party with 50 people who aren't wearing masks, if they can call anybody for that. You could submit a mask complaint. You also could, if you called 311 and let them know about that, they may let the health department know about it in case we need to provide any sort of guidance or any other follow-up on that. I don't know if Haley, if you have any additional comments on that.
Yeah, private parties are allowed up to 45 people. Private gatherings are allowed up to 45 people. If you're at a private gathering with more than 45 people and you realize that people are not in masks, like Janelle said, please contact us. You can use 311. You can give us a call to let us know. And we can try to get in touch with the party organizers to figure out what's going on, provide additional guidance as necessary. So thanks for that question.
think there's one last question. How long does it take to get test results back? And I think that typically it takes anywhere from 24 to 48 hours to get test results back here at the health department. It does vary depending on where you actually take your test. However, if you actually get your test done here at the health department here in Wyandotte County, typically it's 24 to 48 hours to get your test results back. For those that test positive, we are calling you back. If you do test negative, you are getting you're receiving a text message with your results. So it is 10:30. This does conclude our virtual town hall meeting. Again, thank you so much for those that attended. We appreciate all the feedback and questions. Again, thank you to all of our panelists. We will be sending out a short survey asking for feedback and for future topics. And again, enjoy the rest of your day. And thank you.